In this video, I'm going to be showing you guys how to slay your clinicals. The tragedy of life is not found in failure but complacency, not in doing too much but too little, not in living above your means but below your capacity. It's not failure but aiming too low, this life's greatest tragedy. Benjamin Mays. What's up, you guys? Welcome to my channel, Nursing with Key, where I make a whole bunch of nursing related videos, sharing tips and tricks that I've learned along my journey to help you have the smoothest nursing journey, learning from my mistakes. So I know some of you guys are waiting for me to announce the winners of the Saunders Nursing Drug Books. I have made up my mind on the 2 winners, but I will be announcing them at the end of the video. So watch this video and then at the end, I will make the announcement. So I'm currently in my last lap of nursing school. I have about 3 months of nursing school left. And listen, it has been 2 years since I've been in nursing school and I've done my fair share of clinicals. And so I feel that it is safe for me to say that I think I know exactly what teachers are looking for when they are evaluating you on clinicals, which gives me the knowledge to be able to tell you how to do great in them. Now, there are several things that teachers look at when evaluating you, and I've managed to cram them up into 5 different categories. I also have some midterm evaluations that I have received from teachers in the past that also tell me what the teachers are evaluating. So I know that this information is pretty accurate, and no matter where you are in life, I think that these are pretty standard things that no matter who your teacher is, he or she will look at. So if you're interested, let's get into it. Now, the first category is professionalism, and under that there are 4 things. So the first point is the respect of code of ethics. So are you respecting code of ethics? And also I feel like one of the things that falls into that point is your scope of practice. Do you know your scope of practice? Do you know your limitations, what you can and can't do? That is a very, very important part that I feel goes under professionalism. The second point is attendance. Attendance, you have to come on time, you have to be punctual. Teachers are very strict. I mean, nursing teachers are very, very strict when it comes to attendance. I've learned the hard way. So try to go on time, try to be there a little bit in advance. Lately, what I've been doing, I've been on the unit maybe 20-30 minutes in advance. I've read the charts. I pretty much know what's going to be said in report because I read it in the charts. And so by the time everybody even arrives to the unit, I'm pretty much done. I've completed some worksheets. I'm ready to give my medications. I'm ready to roll. So come early, not just because that's what the teachers want, but just because it puts you ahead and it really allows you to organize your day well. And the more organized your day is, the smoother and the easier it is for you. The other thing is appearance. Now, even though I know some people say it shouldn't be that way, there is a certain way that they want you to look in nursing school, and not just for appearance, but also just because of infection control. So, you know, just your regular things, no fake nails, having your hair, you know, up above your shoulders, you know, come with your scrubs washed and, you know, ironed and all of that. So appearance is another thing that they look at when it comes to professionalism. And the last thing is your ability to be able to adapt to new situations. Now, you know that when you're in the hospital, people's conditions can change from 1 minute to the other, and you have to be able to adapt. You have to be able to observe the changes in your patient's conditions and basically adapt to them. So those are the 4 points that go under professionalism. Let's move on. The second thing is administering care. So when you are taking care of your patients, and there are 3 things that fall into that category. First thing is hygiene. Your teachers are going to evaluate hygiene. Now, I know in the beginning of nursing school, it may be boring when you're doing infection control and they're teaching you proper techniques for hand washing and gloving and, you know, how to put your PPE on and take it off the correct way and all of that. But trust me, that is part of the things that is going to make you a safe nurse. It seems like something that is so small, but hygiene, oh my God, like not hand washing properly, not gowning properly. Not only does it put you at risk and your patients at risk, but just everybody in the hospital, because that's how germs spread. So hygiene is definitely something that is very important and that you are 100% going to be evaluated on while on clinical. Second thing is safety, being able to keep your patients safe. And that is not only, you know, putting the bed rails up, it's having the bed down at the lowest level when you're leaving the room, you know, turning the patients properly, and not only safety for the patients, but also safety for you. So, you know, turning and positioning properly, using proper movement so that you don't hurt yourself, because you also have to protect yourself, but obviously protecting the patient. So, you know, putting their glasses on, right? You know that they cannot see properly, yet they're ambulating around without having their glasses on. That puts them at risk of fall. So giving them also their assistive devices, their cane, their walker, their whatever it is that they use. Just making sure that no matter what you do, your patient is safe. And the last point for this category is asepsis or asepsis. So just making sure that, you know, your sterile techniques, you're doing them the sterile way, your non-sterile or your clean techniques, you're doing them the clean way, or whatever, right? So for example, let's say you're doing a wound irrigation or you're doing some kind of wound packing or whatever, knowing when to put your gloves on, knowing when to take your gloves off and maybe put sterile gloves on, keeping everything sterile, keeping everything dirty away from the sterile stuff, and things like that. So those are the three I feel like most important things when it comes to this category. The third category is assessment care. Assessment care, and there are a couple things that fall into this category. Now, I'm going to put the first three things together because I feel like they always go together. And these are the three things that you always look for as soon as you enter a patient's room. And that's your level of consciousness, pain, and vital signs. So you're always going to walk into your patient's room, introduce them, introduce yourself, make sure that your patient is safe. You usually take their vital signs. You'll ask them if they have pain. If they have pain, you'll do your PQRST. You know, so where is the pain? Is it radiating? What type of pain it is? All of that stuff on a scale of 1 to 10, how much? And their level of consciousness. So do they know who you are? Do they know what you're doing? Do they know where they are? Do they know why they're here? All of those things. Are they oriented? ×3, person, place, time. The other thing is just properly monitoring your patients on a daily basis. Now, when you're taking care of a patient, you're not just looking at what they're there for. For example, if somebody comes in and I don't know, they had a hip fracture or whatever, yes, you're obviously gonna, you know, really pay attention to the fracture or to the wound site, right? And looking at the dressing and all of that because they just did a hip replacement surgery or whatever. But you're also going to look at all the other systems of the body. For example, when you take vital signs, you're looking at the respiratory and cardiovascular system, but you also have to look at their urinary system, their input, their output. What are they taking in? What are they putting out? So every time you chart I chart either by system or by need. So you'll chart, you know, general being vital signs, level of consciousness, all of that. What does their skin look like, right? Is there any redness or anything? If there is redness, what does the redness look like? Is it swollen? Is there pain or whatever? Urinary system, have they urinated? When was the last time they urinated if they didn't? And also digestive, have they had a bowel movement? That's a very important thing when you're on your clinicals, making sure that you are keeping track of your patient's bowel movements. You know that it's not good to not have a BM for more than 3 days. So usually after 3 days, you start to maybe look into different things that you could do to encourage the patient to have a bowel movement or to make the person have a bowel movement. What else? I'm like forgetting, but basically just going by system or going by need and being able to evaluate the patient as a whole and not just for specifically and only what they're there for. So you're not only gonna chart about the wound site if they're there because they had a hip replacement surgery. You're evaluating them from head to toe or assessing them from head to toe. And the last point for this category is your administration of medication. So making sure that, and I don't know if your teachers are going to do this, but I know in my school, my teachers always make us do a medication research once they figured out who we're going to be giving medications to. So they'll give us a list of medications and we'll have to go home, do a research on the classification of the medication, the use, the side effects, your nursing considerations, so what to take into consideration before giving the medication, and what to look for when you've given it, so side effects and possible adverse effects. So knowing your meds is very important, because as a nurse, that is a big part of your responsibility. Another category is planning your work, and that one is very simple. There's 2 points that go into that. The first point is worksheets. You're going to get these very long, very dreadful and boring worksheets every single rotation that you're going to have to fill out, but that is just part of the things that you have to do, and you have to be able to complete them before the last day of your rotation. At least that's how it works for me. So that's the first point. And the second point is prioritizing your care. So when you come in, being able to properly plan based on your patient's situations, which one you're going to see first, who's, sometimes you have meds to give at 7:30, sometimes you have meds to give at 8, and I don't know, somebody might have an appointment at 10, and so many things might be happening during the day, and you're going to have to be able to come in, plan your day in a way where everybody can get their medications on time, everybody's going to be able to, get ready or be ready for appointments they may have on time without you, being, worked up or being overwhelmed. So planning your day is another thing that your teachers are going to evaluate you. And the last category is communication. So the first thing that is very important when it comes to this category is verbal report. Now, when you're leaving, whether you're going on lunch or whether you're finishing the day, you are going to have to update the upcoming nurse for the next shift, or the person who is covering you, on the condition of your patient, so that they know what's going on. So being able to give accurate verbal report, taking the things that are important or that are abnormal, and properly communicating them to the LPN or the RN who is covering you. And the last thing is good documentation. Doing your documentation in a way where the person who's gonna come after you, if they have any questions or if they wanna know anything, they could go into the chart, go into the progress notes, read what you wrote, and know exactly what's going on. It's like a story, but you, like I said, you have to evaluate the person as a whole, from head to toe, starting from level of consciousness, going down to the heart, cardio, going down to the stomach, digestive, going down to the urinary system, going down to the digestive system, and going down to the skin, right? If a person comes with, I don't know, a leg fracture or whatever, making sure that you document your CSM. So can the patient move their fingers or their toes or whatever fractured part? Is there pain? Is there good circulation? You're checking capillary refill. Is it blue? Is there edema? Things like that. So the following nurse has to be able to go into the chart, go into the progress notes, read the notes that you've written, and have a very, very clear understanding of what happened on the floor or on the unit during your shift. Now, drum roll. I know you guys have been waiting for me to announce the winners. So I'm going to announce the winners of these 2 nursing drug books, 2015 edition, brand new, never touched, not never touched, but never used. And the winner of one of the books is London Sky. I'm not going to post her message or anything, but London Sky, that is her Instagram. I will leave her Instagram down here. Beautiful young woman messaged me, left me a really beautiful letter, made me very, very happy. And honestly, I just wish you the absolute best on your journey. I know that you're an aspiring nursing student, and I know that you're going to make an awesome nurse one day. And I'm really happy that I had the opportunity to, even if it's just giving you a book, help you in the smallest, slightest, littlest way. So congratulations to you. Make sure you send me a DM on Instagram, and I will be sending you this book. The second winner is Shakira2222. She also sent me a beautiful DM. Very similar situation to London Sky. These women are young mothers, and I know, well, I don't know because I don't have any children, but I can't imagine how hard it is, to be a mother and still want to go into nursing school, because nursing school takes a lot of your time. So honestly, hats off to you two beautiful women who have children and who are still pushing and still fighting to make it to the top, not only for yourself, but for your kids. I respect that so much. And once again, I'm really happy that I could help you guys in the slightest way. So Shakira 22, make sure that you send me a DM with your information on Instagram, and I will be trying to ship these off to you guys as soon as possible. So guys, if you guys enjoyed this video, I really hope you guys give it a thumbs up. Don't forget to like, comment, subscribe, and I really hope to see you guys in my next video. Bye. If you even notice me, you gotta feel me. Without you